Veterans and service members from all over the country come to the James A. Haley Veterans Hospital here in Tampa if they have spinal cord injuries. The hospital has a specific clinic using exoskeletons to help patients walk. I recently went to the center to learn about the technology that is life-changing. And tonight, I'm highlighting the voices of a member of the Air Force, a physical therapist, and a doctor.
Ever since I was kind of younger, I knew I wanted to join the military.
Sean Stutson landed in the Air Force as a firefighter.
Peterson Space Force Base was my first and last base that I went to, and I spent about 2 years there.
Sean brings us back to when he was at the base in Colorado in August of 2023.
There is where I had an accident. I was hiking and fell off a cliff, about a 50-foot fall. Ended up gaining a spinal cord injury and breaking a few bones.
After treatment in Colorado, Sean came to James A. Haley for rehab.
Exoskeletons are machines or powered equipment that allows patients to be able to walk. And it offloads all the weight for them.
Dr. Kevin White is the chief of spinal cord injuries at James A. Haley.
Why is something like this so crucial for a veteran?
If you ask a veteran when they get injured, one of the first things they want to say is, I want to be able to walk.
We're one of the only hospitals who's taken exoskeletons out of the regular physical therapy clinics and put them in a separate clinic. So this clinic only sees patients who are using exoskeletons.
Dr. Catherine Fitzgerald is one of the physical therapists working with patients like Sean.
This is the exoskeleton. It's one of our rehab exoskeletons here. So we use this mainly for patients who are working on recovering their ability to walk. So it does part of the work of walking depending how much help that patient needs. It does as much work as they need it to do, and then we try to taper down how much the exoskeleton is doing so that the patient is doing more.
Good to go?
Yeah.
I wouldn't be walking, I wouldn't be up on my feet, I wouldn't have the life I have right now, or even the chance of a life I have in the future. I owe it all to this.
What was it like to take that first step for you?
It was very frustrating because I was trying to make my foot, trying to make my leg move, and it wasn't.
Sean has been working with this technology since December.
I had to start first thinking right step, shift, lock out, left step, shift, lock out. Where now it's much more natural.
I mean, you really are learning how to walk again, so that makes sense.
Learning how to walk without being able to feel where I'm at. It's really hard.
It brings a lot of hope to people, the veterans who are using it, and also the veterans who get to see people up and walking around using this technology.
What's the goal?
The goal is a better life today than it was yesterday. I would like to see myself be able to walk again, but if I can just have a better life, that's what it is. Enjoy, have a fulfilling life.